All right, so there's another treatment option known as what sclerotherapy. And sclerotherapy is all about, okay, if you have some veins that are kind of like a varices of veins, right? If you have a varices of veins, you can actually do an injection, and what you are injecting is known as what sclerosant drug. So you inject the sclerosant drugs into the vein. It's basically what it will repair the vein. All right, there will be no much more. There will be no varices again. All right, so let's get to look at this sclerotherapy and see how it is done and everything involved. Okay, sclerotherapy. So sclerotherapy is a minimal invasive medical procedure used to treat what vascular malformation, all right, such as what varicose veins, spider veins, or telangiectasias. All right, so varicose veins, spider veins, telangiectasias, right? All of these can be treated using the sclerotherapy. Indication Indications is more of like, okay, you compiling the disease condition that this sclerotherapy can basically what be um how will I put it, be applicable to. All right, so we've spoken about them, just list them again. So varicose vein varices, spider veins, telangiectasias, right? Hemorrhoids and vascular what malformations at all, right? You can actually use this sclerotherapy where you are injecting a sclerosant drug into the vein just to collapse the vein. All right. So what is the procedure? How can you be able to do this sclerotherapy? First of all, you have to prepare the patient, all right, and that's under pre-treatment preparation, where you position the patient well, you clean the skin so that you don't want to drive infection from outside to inside. Then you could also give a local anesthesia. All right. Then you now inject the sclerosant. All right. So the solution is injected into the target vessel. All right. So the sclerosant will now cause the vessel to become irritated and close up. All right, because in varicoses, the vein is dilated and opened up like that. All right, so you want to actually close it up, right? Then after the treatment, there's a post treatment care. All right, where you're advising the patient to actually what, be wearing compression bandages or stockings, and should avoid heavy exercise or heat. All right, so what are the types of sclerosants that can be used? All right, this sclerosant that we're saying is injected into the vein just to what, constrict the vein back. All right, so examples include hypertonic saline, tetradecyl, Polidocanol, chromated glycerin, okay, ethanol too. So mechanism of action is just basically what, endothelial damage. It will cause inflammation and fibrosis. Then it will cause what, the vessel to close and obliterate. Okay. Contraindications when you shouldn't use this, right? If somebody is pregnant, don't use what, a sclerotherapy. If they are breastfeeding, don't use it. All right, if they have an active infection, don't use it. If they have an allergy to what, any sclerosants that we have mentioned, all right, so from the history of the patient you have known that they have an allergy to a particular drug, then you don't use that drug. Okay, then ethanol, okay, sorry, if they have a severe cardiovascular disease, don't use it. Side effects, right? Sclerotherapy will cause pain, swelling, bruising, infection, and allergic what, reaction, right? Complication, all right. So that's it for what, sclerotherapy. Indications, procedure, types, mechanism of action, and the rest.